Just a couple of things to cover today. As we all know, the um, epidemic continues to progress mostly in the wrong direction nationwide. We've had a bit of a respite here in case counts, and as we mentioned Tuesday, hope that will continue. But in the meantime, certainly deaths continue to catch up as the lagging indicators we know they are. This is a graphic that I've shown periodically. On the left is from those states that had large outbreaks in the spring and where they plateaued. And now we're starting to bump up again in terms of deaths. But you can see New York and New Jersey, Connecticut were the states that had the highest rates of death. New York City, again, higher than those, with a total per capita death rate of 2,800 roughly per million. And now in the middle graph is those states that are having significant activity going on now. And you can see blowing up that center part, North Dakota, South Dakota have had really the highest rates of growth over this period of time. And you can see that they are now both above 1,000 and approaching really equal to now the levels that New York achieved for the spring as a state, and are catching up with New Jersey rapidly. And I think, as we mentioned, may approach New York City's total. Nebraska is down there just above 600, but again, we are also catching up rapidly. As a part of this, the trend of a large proportion of deaths occurring in nursing homes or long-term care facilities continues. These are data from Centers for Medicaid and Medicare Services that keep track of these, and CMS now reports that South Dakota's third ranking in terms of long-term care facility cases per 1,000 residents. You can see almost 46% of long-term care residents in South Dakota have suffered from SARS-CoV-2 infection. In North Dakota, that's about 40%, and those states are on the rise and rapidly catching up with the leaders. You know, the leaders there used to be New Jersey and Connecticut and all of the states in the Northeast, and you can see they have fallen down considerably. As you look at deaths, South Dakota is currently in fourth. Again, almost 11% of all nursing home residents in South Dakota have died. That's not 11% of those infected. That's 11% of every nursing home resident in South Dakota since the beginning of the pandemic has died. And in North Dakota, that's almost 9%. And those numbers are unfortunately going to continue to rise. So I think, again, this points out the fact that we've discussed that when community transmission levels are high, you cannot keep that spread out of these vulnerable populations, despite all of the efforts that we've tried to do. That idea that you can insulate these vulnerable populations and let the rest of the community ride out to herd immunity is a farce. It can't happen. Last thing I want to touch on is vaccine status. Vaccines have been in the news quite a bit over the past week, as we are tracking for hopefully emergency use authorization from the FDA from the two leading vaccines, which have released their preliminary analysis of phase 3 clinical trial data. So right now we expect that both the Moderna and Pfizer vaccines will be approved by the FDA, at least for emergency use authorization, shortly after the FDA's advisory committee concludes its meeting on December 10th. In fact, the Pfizer vaccine has already been approved by the UK this week for use. So what that means is about 40 million doses of these vaccines should be shipped to the US or in the US by the end of the year. Roughly 20 million from Moderna, 20 million from Pfizer. Right now, Pfizer announced this week that they had a setback in manufacturing, some problems with their ingredient supply chain, and that has set back their vaccine projection total, but I don't think that that's going to significantly disrupt us from 20 million doses from Pfizer, at least what it looks like right now. So that means we'll have about 40 million doses or enough to vaccinate 20 million people by early January. And this coincides with the recent meeting and a statement by the CDC's Advisory Committee on Immunization Practices, which recommended Tier 1 vaccinations include essential healthcare workers and then residents and staff in long-term care facilities. So that's about 24 million people that we need to vaccinate. So we're about 4 million short by the beginning of January, but we should continue rolling out vaccine during the month of January and should be able to make up that 4 million and more by the end of the month. So the projection is currently we'll be able to start vaccinating sometime around the middle of this month, and by the end of January should probably be able to complete that Tier 1, Tier 1A at least, and maybe even moving into other high priority populations, which are other essential workers, critical infrastructure, and then people who have high risk for morbidity and mortality, seniors, people with underlying health conditions, et cetera. Right now, the data from tens of thousands of people vaccinated with these vaccines, roughly 40,000 between Pfizer and Moderna, look as if there are very few severe or consequential side effects, but the number of mild to moderate side effects is actually not insignificant. These vaccines, they're both, if you remember, the mRNA vaccines appear to be quite immunogenic and inflammatory at the injection site. So pain at the injection site has been seen with both vaccines and inflammation, so some redness and swelling. And then general side effects have also been relatively common, although usually mild or moderate, things like fatigue, headache, muscle aches, joint aches, chills, even fever have been seen in a large proportion of people receiving these vaccines. And then there have been reports of more severe side effects, such as severe fatigue, severe muscle pain or joint pain, headache, and even fever over 39 degrees Celsius in 2% of recipients. So that's not trivial. And so I think messaging around this is going to be really important, that people have to understand, and healthcare workers are going to have to understand that these side effects are relatively common. Obviously, this throws a bit of a loop when you're talking about high-risk people for exposure getting a vaccine that results in symptoms that can potentially mimic COVID if you have fever and muscle pain and joint pain. So things to mitigate this, such as prophylaxis with nonsteroidal anti-inflammatories, et cetera, are going to be important as part of these vaccine rollouts, but also, again, messaging and information so that healthcare workers and long-term care staff understand that these side effects are relatively common and should be anticipated is going to be important. So that's all for today. Happy to take any questions.